And the DNA analysis company 23andMe has grown into a popular, low-cost way for individuals to determine what genes they might be carrying for specific diseases or disorders. However, just last week, the Food and Drug Administration brought the company's sales to a halt, prohibiting them from selling any DNA kits until the product is authorized by the FDA. Here's how the company promotes the testing kits.
So that's why the sun makes me sneeze.
I might have an increased risk of heart disease,
arthritis,
gallstones,
hemochromatosis.
I'll look into that.
Stuff we might pass on to our kids,
foods I might want to avoid.
Hundreds of things about my health.
Getting my 23andMe results?
It really opened my eyes.
The more you know about your DNA,
the more you know about yourself.
But the FDA isn't so sure 23andMe's Personal Genome Service, or PGS, does what it promises. The order to halt services came by way of a stern letter from the FDA that called out the company for offering the testing and diagnosis services to the public without the regulatory approvals needed in order to market this product. In the letter, the FDA outlined the work the agency has done with the company in the last 5 years, pointing to 14 face-to-face or teleconference meetings and hundreds of email exchanges. Yet despite years of the back-and-forth interactions, the agency wrote, "We still do not have any assurance that the firm has analytically or clinically validated the PGS for its intended uses, which have expanded from the uses that the firm identified in its submissions." So to talk a little bit more about this and its implications, I'm joined right now by Jeremy Gruber, President of the Council for Responsible Genetics. Jeremy, thanks so much for joining me.
Thank you for having me.
Sure. First of all, just so people are aware, 23andMe is a Google-backed product. What kind of traction does it have in the marketplace, and do its ties to Google play into consumers' trust in the product?
Well, it has a very strong place in the marketplace. It's a small marketplace for direct-to-consumer genetic testing companies. And in the last few years, as the FDA has gotten more involved in this area, most of 23andMe's competition has disappeared. So 23andMe is really the only strong competitor left in the direct-to-consumer genetic testing market. And certainly its Google funding offers it a level of credibility with the consumer that none of its competitors ever had.
Yeah, I can imagine with the popularity of Google that this product would probably do just as well. One of the things the FDA is highly concerned about is that the test can give false positive or negative results on the user's risk of something, for example, like cancer or diabetes. What might be the unintended consequences of people receiving this information?
Well, I think the most important thing that the FDA is looking at is making sure that these tests are accurate, because make no mistake, these tests are offering medical test information to the consumer directly. And the consumer should have faith that those tests are accurate. Unfortunately, 23 has not been able to provide any reporting to ensure that their test results are valid. And a large part of that is because the level of their testing is really a research grade level, not a medical data testing level. And of course, once that information is received by the consumer or the patient, it can be used, as the FDA outlined in its letter, to make very important medical decisions. In fact, many of the conditions for which 23andMe tests for are considered medically actionable conditions, such as breast cancer.
Right. And can you talk a little bit more about what kinds of procedures people might go to do when they don't even necessarily know for sure that they really need to do them?
Well, for example, as the FDA outlined, some of the things that 23andMe tests for is for the BRCA1 gene, which is associated with breast cancer. And many people, I have a friend, for example, who tested positive for BRCA1, and she made the decision to have a mastectomy to minimize the chances of her developing breast cancer. Now, of course, there would need to be the intervention of a physician and other medical professionals. So I think some of the FDA's concerns might be a little exaggerated. But I think that the FDA's underlying concerns are very much valid, and that is ensuring that consumers receive medical information that's accurate. because if you start allowing inaccurate information to enter the marketplace, you start misleading consumers, you start letting consumers go down paths where they may really run into roadblocks.
Sure. And what are the risks of this sort of information getting into the hands of insurance companies or employers? Could it result in prejudicial treatment at all?
Well, we do have a federal law, the Genetic Information Non-Discrimination Act, which prevents employers and health insurers from misusing genetic information in the context of employment and health insurance. However, we really don't know, and this is a large part of the concern with these private companies like 23andMe that are starting to obtain genetic information. We really don't know how they secure that information, how they use that information. There is no oversight, and so you really take your privacy in your own hands when you deal with companies like 23andMe.
Sure. Well, I wish we had more time, but unfortunately we're all out. Appreciate you coming and giving your insight. Jeremy Gruber, president of the Council for Responsible Genetics.